All right, so now we're going to talk about the masseter, which attaches to the mandible and the zygomatic arch. And the masseter is a very powerful muscle for elevating the mandible, in other words, closing the jaw. So it's very powerful for chewing. And pound for pound, it is the strongest muscle in the body. The two, left and right masseters together have about 150 pounds of strength. So, I mean, they can chew very powerfully.
I wonder how powerful like a dog's jaw is in comparison.
Yeah, I wonder. I have no idea. But I have seen them crush huge bones, so wonder how that compares to ours. So, folks use the masseter for chewing and also can hold a lot of tension in there. Of course, a lot of people clench their jaws, and sometimes their dentists or massage therapists or other folks might bring attention to this, and they might wear guards against this, but a lot of tension can be held in the masseter and temporalis and other muscles of the face. It appears to me that people are holding even more tension than usual in their jaws with the masks, frequent mask wearing. Folks are kind of holding their mouths differently, and it appears to be holding a lot of people appear to be holding a lot of tension there, even more than usual. I do not have scientific evidence. I don't know if people are doing experiments on that or not. This is just my observation in massage practice. So let's take a look at the O, the I, and the A. The origin is the zygomatic arch, which I'm highlighting in red right now. And of course, that's the cheekbone. And, the prominent, very palpable cheekbone, if you feel your way back and then get to the posterior aspect of it and open and close your jaw, you can feel where that masseter is going, which would be more visible without a mask. But there you have it. And our insertion is the angle and ramus of the masseter, which we don't have a great view of here. So I'm going to switch to the slide that shows us exactly where that goes. And so here we have this whole insertion taking up the angle and the ramus, this whole part. So a big part of the bone there that it attaches to. Let's back up here for a second. So as I mentioned, when looking at the skull model, the actions, it elevates the mandible, which is the temporomandibular joint, and it can assist to protract the mandible, which is putting the jaw forward. Protraction of the jaw is the jaw coming forward like this. So we can protract and retract our jaws. I exaggerated. We can't really make them go that far forward. All right, let's get back to that screen share. All right, so that's a powerful little muscle. Let's go back to this other view of it for palpation. Now, we're seeing palpation on the outside of the face, right on that jaw line. And you can feel there's a pretty beefy little muscle there. You can actually even squeeze it and lift it if you alternately open and close your mouth or clench your teeth. you can feel it harden over there. So feel, the angle of your jaw, and then massage in there. You can go side to side. You can open and close your jaw, and you can clench your jaw. So I'll, show this on the skull again, particularly since I'm wearing a mask and you can't see on me too well. This area right here is a great area. Again, if you open and close your jaw and clench your teeth, you can feel a really beefy muscle right there. Now, as I mentioned at the beginning of class, you can actually feel how thick this muscle is on the inside of your mouth. If your hands are clean or you want to wear gloves, you can squeeze inside your cheek and kind of roll through the tissue and feel that your masseter is very strong. Now, the only time we put our hands inside clients' mouths is if you have an intraoral certification and license. So that's an extra certification and license that you can get as a massage therapist, and it's especially helpful for temporomandibular joint dysfunction and any of the jaw, clenching, grinding, tightness, etc. So very easy muscle to palpate and massage, and you can include it, just in your face massages, whether it's circular friction, linear friction, cross fiber friction, myofascial release. You can start down there at the bottom of the jaw and do like that sloth MFR we did on the face, and start that all the way through the masseter. But now, while a lot of people are aware, if they grind their teeth or have, those kind of problems, a lot of people don't. It's one of those areas that a lot of people hold a lot of tension, and they might not really be aware of it until, they start receiving some massage in the area. So that's a really good one. Now that people are wearing masks in our clinics, I would ask permission before massaging them there. But like you can see, like with my mask design, I don't have to take off my mask to, massage that. So, I try to still include the muscles and fascia that, you don't have to remove the mask for, because again, people are holding a lot of tension there.